I really appreciate the opportunity to talk about this because I think it's clearly central to long-term happiness and therefore to the potential for long-term success. No question about it. So let me make some general comments and then some personal comments and then administrative comments. So let's just take the premise I mentioned earlier. Whatever you do, you're going to be working hard. Right? If you start with that, then the next point is life gets in the way. I mean, significant things will happen to everyone or their family members or their loved ones. And these can be very impactful, sometimes chronically. And so the issue of how one manages whatever aspirations you have in your career with being able to live happily with people whom you love and to have friends and to have an enjoyable social life as well. So that is an important goal. And I would say that we all sort of figure it out in one way or another until problems do become more severe, until the strains become more severe. So let me tell you a little bit about my life and the sort of epiphany that I was able to benefit from. So I see patients half time, I do research half time. You know the administrative part of me, and I am very fortunate to have a family with 2 young girls. And one of the greatest things I enjoy is having dinner with them essentially every night. So how does one, put those 4 things together? And that leaves aside, other things, friends and such. How does one make all of that work? Well, it's a particular challenge if you are really wanting to do well. If you really want to push and, be very good clinically or be very good in research, the more you're trying to push forward, the more strain develops, right? So for me, when I'm in the middle of writing a grant, it takes at least 6 to 8 weeks of intensive work, right? It is impossible to do everything else well. It just isn't. I always, at the minimum, do my patient care as well as I can. But, when it comes to answering emails or doing this or filling out some forms, it just doesn't happen. And for people who are inclined to always want to do well, that really can become a stress. So the word that I like to use is equipoise. You need to find an equipoise. And it's easier said than done. But I can tell you, sometimes you meet a person or you hear an idea, or in this case, you read a book and you say, aha. So for me, there's an extraordinary, relatively short book that to me made a huge difference because it was freeing. It allowed me to feel comfortable in my own skin. And it was by the first woman to win a Nobel Prize in medicine, Rita Levi Montalcini, the woman who developed, who discovered nerve growth factor. It's an utterly extraordinary personal story and scientific story. She, as you can imagine, is someone who is driven toward perfection. But she, as a Jewish woman during World War II, made the first discovery of nerve growth factor hiding in a bedroom working on chicken eggs, right? Imagine the stress that was surrounding her. So when you think about perfection, she turned it around, and the title of her book is In Search of Imperfection. And the concept was that you will never be perfect in all things at the same time. It's going to be a modulated experience. You can be really good in 1 or 2 things and really feel like you're giving the best, but other things are going to fall down a little bit. And you can say to yourself, that's okay, because I know I'm going to do a good job and I will take care of those things as soon as I can. And so what you find is it's kind of a float from one thing to the other. You keep your strategic goals in mind, but the equipoise is that you cannot do everything perfectly all the time. You can't. And what is psychologically freeing is to realize that's okay, right? So you don't have to feel this enormous constant strain that there isn't something you're doing. So anyway, easier said than done. But the point is, I think that the more confidence that you develop in your career, right, the more success you have, the more secure you can be in knowing that you will manage all things, although one phone call may have to wait to Tuesday and one email have to wait to Wednesday. Administratively, I would say that I try to embrace this concept among our faculty and our trainees, which is to say, look, people get sick at times, their parents get sick, and it is just okay, and the rest of us just have to make it work, period. I mean, it's not like a discussion. You don't want to add additional strains and stresses if someone just isn't able to meet those demands at the time. I tell you, since being at Mass Ioneer, one of the things I am most proud of in that regard is the way that our institution has embraced the female residents who have children, become pregnant and have children, right? That's kind of a pretty substantial commitment, psychologically, physically, and over the years, we have just done an extraordinary job. I think one year we had 3 women pregnant at the same time in the same class, if I remember correctly. It's just extraordinary. But you know what? We did it, right? And it just has to be that way. So I think it's really important to know that if you embrace those ideas, that you want to do your best to share those ideas with everyone else. And frankly, being in an institution that thinks in that way, to me, is the kind of place that I have wanted and really enjoyed working.
And that at Mass Pioneer, we have a culture here of supporting women and supporting parents. And it started with Dr. Miller and then also Dr. Lorich, our program director, who are both mothers and both had children in training, and really set an example of how you can carve this path out for yourself. I had a few classmates who were also mothers. So there was always someone to turn to for advice, which I thought was really helpful. I think that in order to be successful, you have to have an incredible support system, and you have to have a backup plan for your backup plan, always in place. And in addition to that, you really have to pull upon your organizational skills. It's really important to be incredibly organized when you have so much to balance. And I think that really helped me in terms of planning for Chief Year, because I've become so incredibly organized that I make sure that there's nothing that isn't in place for my trainees. I will also say that I feel like I gained 8 new children this year starting as chief resident, constantly worrying about their well-being and their success and how I can help them become successful at every step of the way. So I think it's really important, first and foremost, to choose a program that is supportive if this is a path you want to go down. And I think Mass Ioneer is a wonderful place for that. And overall, I feel becoming a parent has made me a better ophthalmologist and a more compassionate physician. And it really has pushed me to strive even harder to accomplish my goals. So I think I'm very lucky to be in an institution like Mass Ioneer.